Hi everybody, welcome back to M Factor. In the previous class, we have discussed about the three meningeal layers, and the topic here we're gonna discuss today is the CSF, cerebrospinal fluid, that fills the subarachnoid space, the space between the arachnoid matter and the pia mater. CSF, cerebrospinal fluid, is a tissue fluid in the subarachnoid space around the brain and the spinal cord. It fills the ventricles of the brain, cisterns and sulci, as well as the central canal of the spinal cord. CSF actually resembles the limbs in the central nervous system. The quantity of CSF is 150 ml, formed at a rate of 200 ml per hour or 5 liters per day. The pressure of CSF varies from 60 to 100 mm of water. So let's discuss about the formation, circulation and absorption of the CSF, and lastly about its functions too. Formation. CSF is formed from the specialized ependymal cells in the choroid plexus or lateral ventricles of the brain. A lesser amount of CSF is also provided by the third and the fourth ventricles. As the limbs are formed, CSF is also formed by the capillaries on the surface of the brain and the spinal cord.
Circulation of the CSF. The CSF circulates within the ventricular system of the brain. The ventricles are a series of cavities filled with CSF. As the majority of CSF is produced from within the two lateral ventricles, from here the CSF passes through the interventricular foramen to the third ventricle, and then to the fourth ventricle through the cerebral aqueduct of midbrain. From the fourth ventricle, the fluid passes into the subarachnoid space through four openings: the central canal of the spinal cord, the median aperture, and the two lateral apertures in the roof of the fourth ventricle. The CSF is present within the subarachnoid space, which covers the brain spinal cord and stretches below the end of the spinal cord to the sacrum. Absorption. CSF is absorbed from the subarachnoid space via the arachnoid villi and granulation, and is drained into the cranial venous sinuses, also absorbed by the perineural lymphatics and veins related to the cranial and spinal nerves respectively. Functions of the cerebrospinal fluid. It decreases the sudden force from the outer environment and protects the delicate nervous tissue. It also nourishes the nervous tissue because the CSF is the only fluid that comes in contact with the nervous tissue. It nourishes the nervous tissue and returns the product of metabolism to the venous sinuses. It also provides with glucose and oxygen, which are essential for the nervous tissue. The pineal gland secretions reach the pituitary via the cerebrospinal fluid. The CSF also acts as a cushion. As there is no CSF-brain barrier, the drugs can reach the neurons through the CSF. As the blood-CSF barrier is present, there is no antibodies in the CNS, which makes infection of the brain very serious entity. CSF can be obtained by the lumbar puncture, cisternal puncture, or the ventricular puncture. Lumbar puncture is the easiest method and the commonly used method. It is done by passing a needle or making a puncture in the interspace between the third and the fourth lumbar spines. Hydrocephalus is the dilation of the ventricular system and occurs due to the increased formation or the decreased absorption or any obstruction in the flow of the CSF. The clinical features of the hydrocephalic condition is larger head size, tense anterior fontanelle, dilated veins over the thin skull. Thanks for watching. Hit on the subscribe button and stay tuned for the next classes on spinal cord.